Am I going to be buried with my breast implants? Okay, I have patients that come into my office and they ask me, am I going to go to the grave with these? Or can I get them out so I don't have to? And I don't think that they're really thinking about dying and what's going to happen in the casket later on. What they're talking about is being in their 50s, 60s, and 70s with breast implants and not wanting to have another surgery down the line. Oftentimes, I have these patients in my office and I say, let's do it. Let's do an explant surgery, remove the implants, remove the scar tissue that's around them, and leave you with your own natural breast, sometimes with a lift, sometimes with fat transfer, to get you in a situation where you don't need any more surgery for the rest of your life. And I think that's powerful because the truth is, whenever you have an implant put in your body, it's going to come out. There's no such thing as a lifetime implant, okay? So, many different implants need to come out or be serviced at some point. So breast implants can last between 10 and 20 years depending on the manufacturer, how they're inserted. They have a limited lifespan, and you have to decide in your 50s, 60s, whether or not you want to potentially have to have surgery in your 80s, which I've done before and exchanged implants and put new implants into patients at that point. Make the decision early on. Say, when is the time in my life when I'm going to decide that these implants are not for me anymore? Or if you're at that point, have the discussion and say, one surgery and I'm done, and I can get a lift, I can get a great looking breast, and I can also improve the shape of my body by taking fat out, and I'm at a healthy enough point now to do that and not worry about it in my 70s, 80s, and 90s.